Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today, I want to talk about chronic pain, how it develops, and what we can do about it. So for those that have dealt with chronic pain, they'll tell you how difficult it can be. There's a lot of confusion around it. A lot of providers don't know how to handle it. There's an over-reliance on imaging that can be not helpful, or not only not helpful, but sometimes harmful. And we'll dig into all that. I had this one patient who had developed, chronic back pain, and, she had some imaging. You had the typical L4, L5 stenosis, which just means narrowing, with arthritis, which is kind of the same thing because the arthritis kind of closes down on the nerves. So with that, usually extension or arching the back can hurt, which she definitely experienced. But then opening the spine by flexing usually makes you feel better. And at the point she came to us, she was having such bad back pain for so long that getting out of a chair, like squatting would hurt, so getting out of a chair would hurt. And through some of this training we went through with her, we were able to fix it, and now she has no pain. But to understand how we fixed it, you have to understand how it develops in the first place, and understand that, you have to have a deeper understanding of what pain is, because pain is a complicated topic. It's kind of fascinating, but it's probably not the way we traditionally think of it. We kind of have to reframe what pain really is. Pain is an output of a system. It's the way your brain perceives something as a threat. So your nervous system is there to protect you, to make sure you don't die. That's its main function. And it's got the autonomic nervous system, which is the sympathetic and parasympathetic side. And the sympathetic state is triggered when a threat is perceived. So the brain and nervous system, through all of our senses, is constantly taking in data and then interpreting it. So it's got this quantitative aspect through sensory inputs, and then it's got the qualitative sort of output, or the way it interprets the environment. I was listening to the podcast Hidden Brain, which is a fantastic podcast, by the way. It's probably my favorite podcast. And one of the guests was talking about this analogy with the sympathetic state. I thought it was perfect. Imagine a gazelle like out in the Sahara, and a lion approaches, and boom, it perks right up, ears point up, it gets ready to run away, and maybe it does run away. That's exactly what our nervous system does, our sympathetic nervous system. That's an appropriate response to an appropriate, threat. Now, if it didn't have that response, well, chances are that gazelle wouldn't live very long. The lion would get to it. Conversely, if it was sort of always in that state, it wouldn't last long either. Right? So it has to be able to turn on that nervous system and turn it off. So that the sympathetic response from the gazelle it basically turns into a behavior change because it makes the gazelle run away. In a similar fashion, pain can do this, right? So if you touch your hand on a hot stove, even before you even sense the pain, you will quickly move your hand away from the stove. So it's a behavioral change. And just like the gazelle, that if it never went into that sympathetic state, it wouldn't survive long. If you didn't have the receptors for pain, you wouldn't live long. Like in that analogy of the stove, you would very quickly burn your hand off. So pain develops to protect you, and it precedes tissue damage. Usually when tissue damage occurs fully, it doesn't really feel like anything, because at that point the pain doesn't serve a purpose. And I ask this question all the time to my patients. Whenever they had some significant tissue trauma, I always ask them, like I say, I know this sounds silly, but did it hurt? And almost always the answer is no, I didn't feel anything. I just had a female who was taking a bath, and she slipped and fell on a candle votive on her shoulder blade, and she broke that glass votive, and it sliced her whole scapular area. She got airlifted, and she didn't feel anything. If you talk to somebody who's popped their Achilles, they'll be like, "Oh, it was terrible. It was painful." "Oh yeah, it was so loud. It sounded like a shotgun went off." And then you say, "Yeah, but did it hurt?" And they're like, "Well, no, actually, it didn't hurt. It was, the terror of that sound. Many people will equate that to being the same thing as pain. It's not really pain. Now, if you have a partial tear and some fibers are still at risk of being torn, then you'll experience some pain. So I usually tell people if you're having pain, that's actually kind of a good sign. So that's what pain is in the acute version. It's a warning sign. It's your smoke alarm, right? What happens to trigger to go into sort of long-term chronic conditions? I kind of think of it a bit like, to use yet another analogy, when your check engine light comes on your dashboard and you take it into the shop and they fix whatever problem there is, and then they forget to turn off the signal, and so now the check engine light is still stuck on, so it's like erroneous information. Well, there's several factors at play here, but the role of expectation, I think, is a big one, and the role of control or lack thereof is another one. So, if your expectation is you did the surgery or you had the procedure or you took the medicine or you did the therapy and the pain doesn't immediately get shut off, you expect that it's going to just go away, that can lead to a sense of like loss of control, and you start to sort of ruminate about what happened and fascinate about the future, right? This is going to be the new pain, nothing's going to fix it, right? And then you just kind of go in this sort of negative feedback loop, and it just spins out of control. Then the mind starts to think, I can't do this anymore, I can't play the sport I like to do, going upstairs still hurts, right? When that becomes the fixation point, that's a sign that you're in that negative loop. And so remember this point about control, because it becomes a big part of what to do on the other side. Now, this is not to say that the pain doesn't have any actual mechanical component. So when I say mechanical, I mean like actual stuff going on in the area. So with that woman with stenosis and arthritis, yeah, that arthritis is really there. It is actually contributing to the pain, but the perception around that can augment, or the negative perception around that can really augment the pain experience and trip her into chronic pain. And then there's all the lifestyle factors, right? So if you're eating a highly inflammatory diet, that can contribute. If you're sleeping poorly, that can contribute. That's a really difficult one, because when you're in pain, then it's hard to sleep. And then you don't sleep and the pain gets worse. So it's another negative feedback loop. When this happens, then you're like that gazelle on high alert. Or even if you're not in terrible pain and maybe you're not in a terrible amount of stress, imagine that gazelle, okay, now the lion is backed off, or maybe the gazelle has escaped, but he knows in the background there's a lion still on the prowl, and he's sort of in this like low-grade state of awareness. That is almost just as bad, right? These are the types of things that will sensitize a nervous system. And that right there is a really important point, because that's basically Western society. How many of us are in this chronic, sort of low-grade inflammatory state with this like lurking stress and like basically hypervigilance, which, by the way, triggers a stress response, which means cortisol is pumping through your body, which means sugar is pumping through your body, because that is a rapid fuel source. So that's a body's normal response to make sugar available. That over decades turns into insulin resistance, which turns into diabetes. This is just one of the many factors which is causing sort of all this obesity throughout this country. So let me wrap this part up. So basically the body, or the nervous system, senses pain, and, well, let me say it this way. The brain perceives something as a threat. It sends out a pain signal in an attempt to get you to change your behavior. If things don't resolve, and depending on the way you sort of think about that, that could trip into chronic pain. And then whatever the movement is or whatever the activity is, it becomes mapped to the nervous system. So if walking up and down stairs hurts and you ignore that signal, or you don't do anything about it, or stress in your life is high, or all these things I'm already talking about, and you keep creating that pattern, that motor pattern, that learned template in your brain, then it learns that stairs are painful. And then even if you don't have any actual tissue stuff going on, no tissue issues, you can sort of falsely have a signal that going up and down stairs hurts. So what do we do with a sensitized nervous system? We desensitize it. So we'll figure out the things that are triggering that sensitization. It could be the perceived stress. It could be the lack of sleep. It could be you just need some things to put you into a parasympathetic state. That's why, a lot of my patients get massage. Because what does massage do? It puts you into a parasympathetic state. So that temporarily, at least, turns off the alarm system. Then we introduce movement that's non-threatening, right? So in the example of going up and down stairs, maybe a 6-inch step hurts. So then you try a 4-inch step or a 2-inch step. And you find the movement that's similar, and that doesn't hurt or doesn't trigger the pain. And then you do that repetitively, and over time you slowly build up to maybe from 2 inches to 4 inches to 6 inches until the brain relearns that that is not a threat. This is why breath work is so potent, because breath work, you can easily turn on your sympathetic or parasympathetic state just through breath work. There's a bunch of different ways to do it, but if you watch how you're breathing and you're breathing with your chest first, you're breathing sympathetically. So that's kind of an assessment, but you can kind of reverse engineer it. You can turn on the parasympathetic system by focusing on belly breathing. So as you inhale, your belly should rise first. Breath work is particularly great for low back pain because as you inhale, your spine slightly extends, and as you exhale, it slightly flexes. So what you're doing there is introducing a small amount of range of motion of the spine that is usually not painful. Very few people have pain just by laying on their back and breathing. So you introduce non-threatening movement. When you start learning how to move that doesn't trigger pain, you start to get some of that control back, and this is what I do a lot for patients that are kind of stuck in this mode. Is I've got a big whiteboard in my office, and when they're like, I can't do this, I can't play golf anymore, I can't run, I will just break out the marker and start talking about all things they can do. Well, you can bike, you can maybe play pickleball, or you can exercise your upper body, you can do the rowing machine, and I start listing this huge compilation of things that they can do and say, look at all the things you still can do. And then as therapy proceeds, more things get added to the list as they become less painful. And suddenly they say, okay, I do have some control on this, and they start fixating on the positive rather than the negative. That is usually a huge turning point for my patients. And if you happen to be a physical therapist, listen to this. I think that's a really good thing to do. I had one patient doing like bridges, and they were really painful the first couple times. And then, just with a little bit of training, so start off with smaller bridges, get a little abdominal bracing going on. She was able to do bridges in like 2 to 3 sessions without any pain. And I said, look at that. That's a win right there. You start pointing out all those wins, that goes a huge way for them. So what is all this really doing? What it is you're regaining control of your nervous system. You're learning to go from sympathetic to parasympathetic. This is why I've always been such a big fan of cold plunges. I don't like cold plunges for inflammation. I don't think that's the right methodology. I think it's about learning to control your nervous system, right? Because you get in cold water, it's an immediate threat. You start rapidly breathing. That's a very sympathetic state. You'll see, online, people are like, oh, it's a stressor on the body. It is a hormetic stressor. There's a difference between a distressor and a hormetic stressor. A hormetic stressor it's like exercise. Say you're sprinting on a bike, your heart rate goes up temporarily, but then when you get off the bike and for that week, your heart rate is lower. So it has a positive adaptation response, and that's what's happening in the ice bath. You get in there, you're breathing heavily for a couple seconds, you say it's going to be okay, you talk to yourself, say, hey, just slow it down, and then suddenly it gets easy. So then you're going from immediate sympathetic response to then a controlled parasympathetic response. Plus, the ice bath is great because it takes 2 minutes, so a very quick return on investment. All right, so where are we at with all this? With the things you can do, I would say the first and foremost important thing to do is focus on what you can do, focus on the positive versus the negative. Then you want to identify the things that are increasing the stress to the state that you're in. So that's all about eliminate and mitigate what you can. So eliminate the stressors as much as you possibly can, and mitigate what you can too. It can be really challenging to solve sleep initially, but there are steps around sleep that you can do that maybe make it better. Things like making the room colder. Then I'd find things that help you get into a parasympathetic state more often. So that could be breath work, that could be massage, that could be cold plunging, whatever you like to do. In my opinion, there's not one that's more superior than the other. These are all just options. It's just really the one that you respond to best. And I think a good therapist is going to have a lot of different tools that they can try on patients. So maybe they try one attempt, doesn't work, and they have to try a different, type of modality. So, for example, we have kind of a little bit of a parlor trick that we use. I wouldn't call it a parlor trick necessarily, but it's a type of distraction that's pretty potent. So we have something called the ARP Neuro, which is a very strong electric stimulus. So if you've heard of a TENS machine, think of that, but just way stronger, like 1,000 times stronger. And the difference is we don't just put it on to distract the pain, we do it with movement. So, for example, I'm going to bring it back to the woman who was having a lot of pain squatting and getting out of a chair. We put that on the painful spot, and then we had her do, up to, I think it was like 50 to 80 squats with it on. And so with that stimulus on, it's so strong that you don't feel pain. You only feel that stimulus. And then you do a lot of repetition of the movement that's provocative. And over time, she was able to easily get out of a chair with no pain. It works like magic. But all it really is doing is rewiring the brain, rewiring the nervous system to perceive that movement as a non-threat. And I just want to touch on the piece I was talking about on expectation. If you expect that pain is just part of life, then you don't perceive it as such a threat. So it's something like 80 to 90% of people experience back pain at some point in their lives. It's just a fact of life. If you expect that there's no magic bullet and that it's a process, I think you're going to have a better rehab. So if any of this is ringing a bell for you and you can relate to this and you just need someone to help coach you through this process because it can be kind of difficult to navigate, give us a call. This is exactly what we do. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.